Hi, my name's Jill Duncan. I'm 42 years of age. I was diagnosed with mouth cancer back in November 2020. It's originally started with a small ulcer underneath my tongue, which would not go away. I obviously went to see the dental hospital in Dundee, and once checked over, I was confirmed that there was several patches underneath my tongue and a biopsy would be required. A biopsy was taken, and several weeks later the results were delivered. At the time when the results were delivered, I wasn't advised to attend with my husband. I attended the appointment alone, and I was advised I have mouth cancer. The dental hospital don't specialise in Dundee, they don't specialise in mouth cancer, and it's the Max Fax department in Ninewells Hospital. And I was told that due to the location of the cancer, I would receive an urgent referral for this department. Later that day, I was given a telephone call with an appointment for the following day with the actual specialist. On meeting the surgeon, I was advised after being examined that the cancer had been caught early and the treatment that I would require would be surgery. Obviously, my fear was, will I lose my hair? Do I need radiotherapy? Do I need chemotherapy? How long is the treatment? How long will I wait until I get surgery? So obviously there was many questions that I had for the surgeon. This appointment I was actually able to attend with my husband. Several tests were advised that were required due to the location of the cancer in my mouth. There is chances that this could possibly go down to your chest and other areas down there. An MRI scan was required and a CT scan. Obviously, these were undertaken very quickly, and the results were advised that they would be given at the next appointment. And the next appointment was approximately 2 weeks later. I was given the news that the cancer was localized in my mouth and it hadn't reached any other places in my chest, etc. The surgeon advised me that surgery is the best treatment and they would be looking to get this done as soon as possible. I was given a date of the 15th of December. He said, unfortunately, I know it is due to be close to Christmas. However, we will ensure that you will be home for Christmas. I went to pre-op appointment with COVID tests and a week of isolation, and then another COVID test prior to actually attending the hospital. The night before surgery, a small arrow had been placed on my neck advising, which I later realised, advising which side the surgeon was actually operating on. I'd actually advised the surgeon that I was happy to go ahead with the lymph node removal on my right hand side, as the surgeon did advise that tiny particles of the cancer can actually go into the lymph nodes and they cannot be seen until tested under a microscope. As I didn't want surgery in the first place, I thought I will get both, as in the large area of my tongue removed, which included the tip, and the extended neck dissection. Being honest, I didn't ask too many questions at the time. It was a bit like system overload. My brain couldn't process the fact that I have cancer and this is happening to me. Anyway, I underwent surgery, which took approximately 6 hours from leaving the ward until I was back onto the ward. Once I obviously woke up from surgery, I had stitching from my ear to just past the middle of my neck, and obviously I had a lot of stitching inside my mouth. I sounded like I had been to the dentist and my mouth was numb. I had a weakness down my right hand side of my face, and obviously huge swelling from my chin down to my neck along here. Obviously, after surgery, I couldn't move my neck. I had a drain present, which was obviously something that the surgeon was keeping an eye on. And I was told that I would not be allowed out of hospital until the drain was under 40 mils. But each day I would check the bag, and I was delivering things like 80 mil, 75 mil, and I knew that it would be some time before I was able to be let home from hospital. Eventually, the surgeon had advised that I was getting home from hospital. I think a big factor of this was to do with the emotional side of it. Being in hospital alone, having no friends and family with you due to being in COVID times, was extremely hard, mentally and emotionally. I have to say it's the hardest thing that I've ever had to deal with. And the surgeon said, I think the best thing for you and your recovery is that we'll let you home. Obviously, you have to take it easy and look after yourself. I was given antibiotics, I was given painkillers, and those had to be taken every 4 to 6 hours for at least 2 weeks. Obviously, Christmas came and went, New Year came and went, but my focus was obviously on getting myself back to me, the me before cancer. The recovery at that point was difficult. Eating was a struggle. Talking, very difficult. Since surgery, my mouth was always dry, very lack of saliva. However, I was determined. I was determined that I would succeed, and I was determined that I would beat this. On the 23rd of December, I had to attend the hospital to get my stitches removed, which I have to say I was not looking forward to. On attending the appointment, the stitches were removed and the surgeon said, we have your pathology back. Definitely the cancer was taking out and more on my tongue. And he was able to confirm that there was no cancer present on my lymph nodes in my neck. So I have to say it was the best Christmas present I had ever been given, to know that the cancer is gone. And now my focus was the start of the recovery. Throughout my recovery, I accessed many services. My main goal was to get myself back to me. I obviously couldn't move my neck. My speech was slurred, the weakness on the side of my face. I was determined that I would succeed. And I tried through many different channels to find speech therapy because my speech wasn't clear. I also looked for physiotherapy. Now, during the COVID months, this was obviously difficult because some places were not seeing patients. Now, as far as I was concerned, I didn't need to see a speech therapist face-to-face. A Zoom call was sufficient. And around about February this year, I managed to find a speech therapist who had experience in the type of cancer surgery that I had. Now, I'm based in Dundee, and this woman was based in Essex. There was no one local to me that was able to offer me a service. I had spoke to numerous speech therapists who said, I'm sorry, I can't see you. And it's quite disheartening to think that I just need someone to help. I need someone to make me feel like me. However, I got my speech therapist at the end of February, and I was given exercises to do daily, and I would do things whilst lying on the sofa watching TV in the evening, and I would sit and do them religiously. I was determined that I wanted to be back to me. I didn't want to be slurring my words, having a lisp, struggling to say certain words and sentences without just not sounding right. So I started off with the speech therapy, and then I moved along to physiotherapy. Obviously, when I first came out of hospital, I was unable to look over my shoulder, as previously mentioned. I worked hard just by doing simple exercises, as in lifting my arm above my shoulder, which I was told at surgery I wouldn't be able to do this. There's a possibility. I had to explain to the physiotherapists, which thankfully was local, my reasonings for requiring this. And I suppose in a certain way, it was a justification to have an appointment during COVID. And I said to them, I can't move my neck. I can't drive. There's many things. I could not lift 2 dinner plates in my right-hand side due to just weakness since surgery. So I built that up myself, and I did round about mid-March start to get physiotherapy, and exercises was given. The physiotherapist actually advised that when I walked in on my very first appointment, I walked in and I was poker straight. I did not move my head, my neck, anything at all like that. And we had many appointments, and I would be given different exercises that I would try throughout the day, throughout obviously whilst I was off work. And each appointment, attending these was a boost to show how hard I'd actually worked. As 2 to 3 weeks later, the flexibility, the movement, and everything that I had and I'd worked hard on was actually being noticed by these specialists. My speech therapy, again, I was advised to take pictures, videos whilst speaking, and practice different words, different exercises, and record and take images so that I can reflect back on how I was when I started and how I progressed. During the physiotherapy, at one point, there was an issue with trapped nerves, obviously due to the neck dissection. And at one point, I bent in the shower just for a bottle of shampoo, and I could not move. I actually felt like a stabbing pain down my back. I then went and found a local osteopath who massaged, gave me exercises and manipulated the muscles to allow me to be able to move again. Without these specialists, I wouldn't be the person that I am today. Obviously, I started to work. This was working on the physical aspect of being able to move my neck, being able to speak, being able to drive. But there was a large area that I had to personally work on, which was my confidence. My confidence was really, really low due to not leaving the house for a long period of time. Visually, being able to see the weakness in my face, the swelling underneath my neck. My face was not symmetrical as it was prior to surgery. I was told it can take up to 18 months before you will actually be you and how you are left after surgery. Now, 18 months seems like a lifetime away. However, I decided as time was going on and my physical fitness had improved, along with the speech therapy, the physiotherapy, I looked to give me confidence to be me, the old me, but the new me. I then looked into lip fillers. Because this part of my mouth had drooped, I wanted to see if lip fillers would make a difference. I spoke to my dentist who carried out these procedures, and he said obviously due to COVID, that they were not happening, but as soon as they were happening, they would let me know. So I went ahead and got lip fillers done. I also got microblading done on my eyebrows, again, to make my face look a bit more symmetrical. These themselves assisted in the boost of my confidence and being able to face the big bad world out there as the new me with the big scar, trying to, I suppose, make myself look like I was prior to surgery, prior to any surgery, any damage to my body. They did help greatly. So I wouldn't be the person that I am today without those therapies and those professional individuals that helped me along the way. Now, these individuals themselves had never dealt with cancer. Obviously, family, friends, they may have experienced, but them themselves had never dealt with it. But I honestly kept thanking them to say, I wouldn't be the woman I am today if it wasn't for you helping me, boosting me every appointment, letting me know how well I've done and how well I've worked. And I'm grateful for that, the help and support. Obviously, the physiotherapist, the osteopath and the speech therapist, they were actually delivered through my private medical health. Unfortunately, there was a delay in the NHS side and I was only given speech therapy. However, that was nearly 5 months after surgery. And once I actually got the appointment, she was so pleased with the progress and the hard work and effort that I'd made from my surgery. So 5 months and how hard I'd worked, it was actually noticeable, as she did not see much of an issue effectively in the way that the surgeon had obviously first advised. But yeah, it was certainly, it got me to where I am today, and I am extremely grateful for it.